Protein binding of drug. Protein binding of drug. Let us see what is this. A drug in the body can interact with several tissue components, of which the two major categories, blood and extravascular tissue. The interacting molecules are generally the macromolecule such as protein, DNA, or adipose. The protein are particularly responsible for such an interaction. The phenomenon of complex formation with protein is called protein binding of drug. Protein binding may be divided into intercellular binding, extracellular binding. Intercellular binding, where the drug is bound to a cell protein which may be a drug receptor. If so, binding elicits a pharmacological response. The receptor with which a drug interact to show response is called primary receptor. Extracellular binding, where the drug bind to an extracellular protein, but the binding does not usually elect pharmacological response. These receptor are called secondary or silent receptor. तो इसमें प्रोटीन बाइंडिंग ड्रग्स में क्या है, द मोस्ट इम्पॉर्टेंट एक्स्ट्रासेलुलर प्रोटीन और साइलेंट रिसेप्टर आर प्लाज्मा प्रोटीन, in particular albumin. Binding to such protein is important from the viewpoint that the bound drug is both pharmacokinetically as well as pharmacodynamically inert. That is, an extracellular protein bound drug is neither metabolized nor excreted, nor it is active pharmacologically. A bound drug is also restricted since it remains confined to a particular tissue for which it has greaterly affinity. Moreover, such bound drug, because of its enormous size, cannot undergo membrane transport, and thus its half-life is increased. Next topic is mechanism of protein binding drugs.